Hello, I'm Dr. Maple, and I'll be your specialist for your cranial nerve examination today. Now, as you know, your family doctor sent you for this consultation because of the little concussion that you had a couple weeks ago. So don't worry, I'll be trying to speak as softly as possible through this entire examination to make sure that I don't cause any irritation to you that's unnecessary. During this entire process, my biggest priority is your comfort as well as your health. So with that being said, if there are any exercises or moments where you feel at all uncomfortable, just please let me know, and we can either take a break or maybe just a few deep breaths, and then we can come back to the examination after. Okay? Perfect. So, if this is your first cranial nerve examination, basically what we're going to be doing is looking at some of the different nerves and their functioning, making sure everything's symmetrical and behaving how we think it should. One thing I will say is because you've had a recent concussion, you may be performing a little bit lower than you normally would, but we are taking that into account, and by no means does that mean we would be worried, because we would expect that. Yeah, so basically we're looking for things above what we would expect from a post-concussion. Okay, perfect. Well, let's just get started and go over some of your information. I know that you already talked with the front desk, but we just like to triple check things around here just to be safe. So could I get your full name? Perfect. And your address? Oh, that's a really nice area. Yeah. And what about a phone number to contact you at? Home number, cell phone, whatever you think is the best. Okay. And any sort of emergency contact number if something is to happen. And that is your... Okay. Perfect. And your birth date. Okay. Now, as for your accident, it says here that you went to your original doctor appointment 2 days after the accident. Yeah, perfect. Okay, and have you noticed any different symptoms since that doctor visit? Any symptoms that have gotten better? Any symptoms that have gotten worse? Okay, yeah, that's good. Yeah, that's what we would expect, so that's a good sign. Okay, and do you have any allergies at all? Okay, what about to latex? Oh, good, perfect. And is there anything in your medical history that you think that I should know about? Anything that you think would change the results of the tests at all? Okay, I think that is everything for now. I will be taking some notes throughout the examination just to pass along to your family doctor. But for now, let's begin our examination. So let me grab my gloves. Now, the first thing I'll do is just give you a visual and a very gentle examination of your skin and your scalp and the surrounding area, just to see if there's any big indications or any big obvious problems before we begin. But before I do I have permission to touch you? Yeah, of course. We always like to check. Consent is very important in the field of medicine. So I'm going to start now. I'll just be gently pressing on your face. There should be no pain at all. It should just feel like a very light pressure. Okay? Perfect. So let me get in here. Check here. Yeah, just let me know if anything does hurt, because it shouldn't. Okay, that feels good. What about here? Okay. That is good. Yeah, so I'm just checking the muscles, making sure everything's also symmetrical. That's an important part. Okay, what about under here? Yeah. Does this feel tender at all to you? No? Okay, good. Okay, what about your jaw here? Yeah, you have really nice skin. It's always good. Okay. Perfect. I think everything is as it should be. I'm now going to go around and check your scalp. Now, I know that's where the site of your injury was, so don't worry. I'm going to pay lots of attention and take extra care just to make sure I don't disturb the bruising there at all, because that might hurt a bit. While I am checking that though, I'm just going to give you this thermometer. If you can just put that under your tongue. Yeah, perfect. And I'll be right back. Okay, let's look over here. Your scalp looks really healthy, so that's good. Okay, here's where your bruising is. I'll be very gentle. Let me know if anything hurts. Okay. Is this tender here? Or is that okay? Yeah? Okay, good. Okay. I think everything is looking good back here. Okay, let's see how this guy is doing. Yeah, all good. That is normal range, what we like to see. Okay, so we are going to start with your ocular nerves, and the reason for this is because you did just have a concussion. I realize that you might be a bit more sensitive to light, so we will be using a flashlight for some of the tests, but now we can kind of do the flashlight tests earlier, and then for the rest of the exam you can just relax a little bit and know that it won't be as irritating. How does that sound? Yeah, perfect. Okay, so the first exam I'll do before your pupils have gone crazy with all the light exams, I'm going to be testing your pupil reaction independently from each other. So I'm going to be putting a hand down the middle of your face, and then I'll be shining a light in each of your eyes, and then I'll see how the opposite pupil is reacting. Okay? So you can look ahead, you can look off to the side. This exam, it doesn't really matter. I'll just be looking at your pupils. And if at any point you feel uncomfortable, just close your eyes for a few seconds, maybe blink a few times. We can even just take a break. It's all up to your comfort level. Okay? Perfect. So I will start over here. The flashlight. Yeah, it's quite bright, but don't worry. It won't hurt you at all. It just feels very bright. Just a bright light. A little bit faster. Yeah. Your eyes are very pretty. Okay. That seems to be looking good. Yeah, perfect. Okay, let's do the other side. Everything seems to be good so far. Just a little bit longer. Yeah. Okay, perfect. Let's look at both of them together. Okay, everything is functioning. The signal seems to be quite good. Yeah. Okay, perfect. Let's take a little break from the flashlight. For now, can you just follow my finger for me? Yeah, just keep your head and your neck as still as you can and just follow my finger. Okay, follow. Yeah, what about over here? And back around. Good, yeah. Excellent. Just looking at the tracking movements of your eyes, making sure there's no stuttering, and it's just nice, fluid movement. Okay, what about diagonal? Yeah. Good. Great. What about a little bit faster? Okay, perfect. Now let's try that with the flashlight again, if you're ready. Okay, so follow the light. Yeah, that's it. Good job. Yeah, it's quite bright, but it won't be too long. Don't worry. Okay, a little bit faster now. Follow, follow. Okay. Good job. Okay, let me take a couple of notes here. Okay. Perfect. Now let's look at your peripheral vision. So for the first test, I'll just be flashing some fingers in your 4 quadrants, and just let me know how many fingers you see. Okay? Good. Perfect. Good. Perfect. Okay, one more. Good job. Perfect. Next, we'll do the peripherals again. I'm just going to be taking these 2 pens and pulling them out, and just let me know when you see them exit your field of vision. So just stare straight at my nose again, and just keep at my nose, keep at my nose. When do you stop? Okay, and up and down. Keep looking at my nose. Keep looking at my nose. Okay, and what about diagonal? Keep in my nose, keep in my nose, keep in my nose. Good job. This way. Keep in my nose, keep in my nose, keep in my nose. Okay, perfect. 27. Okay, so next we are going to do our very classic eye exam, but don't worry, we're not checking your exact levels of vision, we're just seeing how your eyes react to the test. Okay, so just as normal. Yeah. Perfect. This one. Good job. Little bit harder now. Okay, and this one. Perfect. Can we try one more? Yeah, perfect. Okay, good job. Yeah, we didn't expect you to get them perfect, but that's okay. You'll get back up to 100% soon. No worries. Okay, we have one more test with the light. This is going to be the last one, okay? This is the swinging light test. I'm just going to ask you to stare at my nose again, and I'm just going to swing the light and see how your eyes react, okay? Perfect. So, stare at my nose again. Just making sure both sides behave the same. Making sure, again, there's no jerky movements. Yeah, keep looking at my nose. Keep looking at my nose. Okay, now follow the light for me. Back and forth, back and forth, back and forth. Yeah. Okay, good job. No more flashlight. But for now, can you look at the tip of my finger and follow it in and out? Perfect. In. Keep following my finger. Keep following out. Okay, good job. What about this one? In and out. In and out. One more. In and out. Perfect. Okay, that is everything for your ocular nerves and your ocular movement. Everything is behaving fine so far. Nothing that would make me worried or cautious. Okay. Next nerve is going to be quite simple. We're going to be testing your olfactory nerve, seeing if your sense of smell is acting as normal. So I have a few jars with a few different very common household smells, and I'm just going to be asking you what you smell. Very simple. So, what do you smell in this one? Yep, coffee. Perfect. And what do you smell in this one? Yeah, orange. Good job. And one more. What is in this one? Yeah, peppermint. Good job. Perfect. Yeah, the olfactory nerve doesn't have as many tests as for the eyes. But now we are just going to be looking at kind of the reactions of the nerves in your skin, seeing if everything is symmetrical mostly. So for this test, I have a soft little cotton bud, and then I have a sharp little toothpick. And now I call this sharp, but this shouldn't hurt you in any way. I'll just be lightly pressing on your skin there. See? Yeah, nothing to worry about. But for now, I'm just going to use the soft one, and I'm going to be going on both sides in the same area. Can you just let me know if everything feels the same on each side? Perfect. Okay, so soft, soft. That's the same. Soft, soft. What about there? Yeah. Soft, soft. And there. Soft, soft. And there. Okay, now for the sharp one. Again, it's not actually sharp, it's just sharper than the cotton bud. So, sharp, sharp. Do those feel the same? Yeah. Sharp, sharp. What about those ones? Sharp, sharp. Same there. Sharp, sharp. And on your chin. Perfect. Okay. Now I'm going to ask that you close your eyes, and I'm going to be doing one or the other, and I'd like for you to just tell me which one it is that you feel, soft or sharp. Yeah, so just close your eyes. Yeah, just close your eyes. There you go. Okay. Soft or sharp. 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 One more. Soft or sharp. Okay, good. You can open your eyes again. The next test is going to be very, very similar, but this time I have a metal stick that is very slightly warmed, and I have one that is very slightly cooled. I'll just test them on you. There's warm, and there's cool. Nothing crazy, just slight temperatures. So again, I'll be going through with the warm one. Let me know if they feel the same. So, warm, warm, feel the same. 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 Perfect. And cool, cool, same there. Cool, cool, same there. Cool, cool, same there. Cool, cool on your chinny chin chin. Perfect. Okay, so again, please just close your eyes. Yeah, there you go. And same thing, just tell me if it's warm or cool. 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 One more. Warm or cool. Okay. Good, Good job there. Excellent. Okay, next we are going to be looking at your muscles of mastication, which are some of the muscles that help you chew, but they actually extend around the side of your head. So if you clench your jaw, you might feel the muscles popping out just a little bit, kind of behind your ears and a little bit above. Yeah, there. So I'm going to ask for you to clench your jaw. And I'm just going to be gently massaging and palpating these muscles just to make sure they are behaving symmetrically. Yeah. Okay, that. Yeah, that is looking good. Yeah. Okay, perfect. Okay, can you unclench your jaw? Just let it hang all loose. Perfect. And clench it again. Good. Okay, and let it loose. Clench one more time. Okay, perfect. Now, if you clench your jaw again, I'm just going to try to open it, but just try to keep it closed, okay? Keep it closed, keep it closed. Good job. Now, opposite, open your jaw, and I'm going to try to close it, but keep it open. Keep it open, keep it open, keep it open. Now to this side, I'll try to pull it back. Keep it to the side, keep it to the side. Good. And to the other side. Keep it to the side, keep it to the side, keep it to the side. Perfect. Okay, I'm just going to check your jaw with this Reflex Hammer, just like you had on your knee when you were a little kid. So I'm just going to very gently go tap, 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 tap. Okay. Everything is looking good. Okay. Now, very classic doctor, can you please open your mouth and go, ah? Yeah, let's see how that is. Looking good. One more time. Yeah, okay, perfect. Okay. Can you repeat some sounds after me? Can you go ka and go? Ka, go. Ka, go. Okay, a little bit faster. Ka, go. Ka, go. Ka, go. Ka, go. Go. Ka, go. Go. Okay, good job. Yeah, that's just testing your articulation there, because there's a few different types of articulation. Okay, can I see your tongue go side to side? Up and down. Perfect. And we are going to be making some funny faces now. Don't worry, I'll make them along with you so you don't feel any bad. Perfect. So raise your eyebrows for me. And frown. And smile. With your teeth. Just your top teeth. And your bottom teeth. Puff out each of your cheeks for me. And both of them together. Yeah, perfect. Okay, now close your eyes very, very tight for me. And I'm gonna try to open them. Yeah, keep them cut. Keep them shut, keep them shut, keep them shut. Keep them shut. Okay, good job. Perfect. Well, everything is looking fine there. I'm going to move on to your auditory nerves. So I'm just gonna go around and look into your ears. Okay? Yeah, just stay sitting right there is perfect. Okay, let's check this ear first. Okay, I'm just gonna pull your ear up and back. Yeah, there you go. Just looking at the canal to see if there's any blockage or any infections. I'm also checking the exterior to make sure there's no damage, but it is looking very good. Yeah, okay. Yeah, looks fine. Okay, let me go around and check the other side now. Okay, that side is looking, so that's very good. Okay, I'm just gonna pull this one up and back, just like the other one. There you go. Now I can move it easier. Okay. Yeah. Perfect. Don't see anything that should be a problem. No, looks okay. Perfect. Yeah. Okay, I think everything is looking pretty good. Perfect. And for the next auditory test, I'm going to have you close your eyes again, and I am just going to whisper some numbers in either side of your head. And then I'll ask you to do two things. The first one, can you just repeat back the number to me that I'm whispering? And can you also just raise your hand on whatever side you think that I'm on? Yeah, perfect. So just close your eyes again. Close your eyes. Yeah, there you go. 2, 7, 5, 3, 1. 8, 9, 4, 0. Okay, so everything is working fine with your ears. I do have a surprise test for you though. Can you repeat back the numbers that I whispered to you? I don't expect you to remember all of them. Okay. Yeah, no, like I said, we don't expect you to remember all of them, so that's just fine. Okay, we just have a couple more things to look at. I'm just going to look at your muscular and skeletal composition a little bit, just in the upper part of your body. So for the first exercise, can you just shrug your shoulders for me as tight as you can? Okay, and I'm going to try to press them down, but keep them up, keep them up, keep them up, keep them up. Good job. Now can you try to lower them as much as you can to the floor? And I'm going to try to raise your arms. Keep them down, keep them down. Okay, now can you try to raise your arms? And I'm going to try to push them down. Raise them, raise them, raise them, raise them. Good job. And now try to bring them down, and I'll try to push them up. Okay, good, 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 good. Okay, perfect. Now with your head and neck, could I have you bring your chin up? I'm going to try to pull your head back down. Don't let me. Keep it up, keep it up, keep it up. Good. Now, opposite, bring it all the way down. As many double chins as you can possibly get. Perfect. Okay, keep it down low. Don't let me bring it up. Don't let me bring it up. Okay, perfect. Now to the side. I'm going to try to pull it back. Good. And other side. I'm going to try to pull it back. Good job there. Perfect. Okay, well, I have some good news for you. We have reached the end of our examination, and I don't feel like there is any warning sign or anything that I would want to look into further. I think you do still have some symptoms of being post-concussion, but at this point we would expect that. It's nothing out of the ordinary, nothing we would be concerned about. So, like I said, I'll be sending a full write-up of this to your family doctor, and I'll be recommending that you just have a check-in with them in about a month, just to make sure that your recovery is going smoothly. But until then, I'll say the only thing you need to do is rest, stay away from heavy work, and before you know it, you'll be back to 100%. If at any point, though, you feel like your condition is getting worse, there's a new symptom, or you're just concerned about anything, feel free to call my office and I'll get back to you and see if it's something we need to look into. Okay? Perfect. Well, thank you so much for coming in today. You were a great patient, very cooperative. Everything was very easy with you. So thank you so much for that. And maybe I'll see you at some point in the future. Thanks. Bye.